Hello, I am so glad you're here with me today. If you're listening to this, it likely means that someone you love very much is currently in hospice care. I just want to start by acknowledging that you are walking one of the most profoundly meaningful and undeniably difficult roads a family can ever travel. It's a time filled with so much deep love, but also, quite naturally, a whole lot of uncertainty and worry. In all my years of walking this path with families, I found that my main goal is simply to sit with you, to help you feel informed, prepared, and deeply supported through every single step.
So, instead of a sterile clinical overview today, let's have a discussion to better understand a difficult topic. We're going to take a close look at something that comes up so frequently for our hospice patients, and that's urinary tract infections, or UTIs. Now, when a loved one gets an infection, our very first instinct is usually alarm. We want to understand why they keep happening, why they suddenly seem so incredibly hard to treat, and how we should truly be thinking about care and comfort when someone is nearing the end of their beautiful life.
To really understand this, it helps to look at what's happening to the body as a whole. When a person is on hospice, they are in the natural process of dying. For some folks, this moves quickly, and for others, it's a very slow, steady transition over weeks or even months. But either way, what's fundamentally happening is that the body is gradually winding down. All of its miraculous systems, the heart, the lungs, the digestion, and crucially the immune system, are just slowly resting. And please hear me when I say this. This winding down is not a failure. It's not something you did wrong, and it's not something the doctors did wrong. It is simply the natural, expected part of a life coming to its gentle end. Understanding this deeply changes how we view illness and treatment in these final days. Now, let's talk about why urinary tract infections are specifically one of the most common things we see. As your loved one becomes weaker and more frail, several very physical changes happen. Bladder control naturally becomes harder to maintain. Just getting out of bed to go to the bathroom becomes difficult, or maybe even impossible. They naturally begin to drink far less fluid, which means the urinary system just isn't getting flushed out the way it normally would. And their body's natural defenses in that area simply weaken. You see, all of these factors combine to create the absolute perfect environment for bacteria to grow. So when a UTI shows up, it's really not a surprise. Actually, it's very expected. I know that for most of us, our past experiences with UTIs look very different, which can be confusing. In healthier times of life, you feel the discomfort, you go to the doctor, you take a quick round of antibiotics, and a week later, you're perfectly fine. That's exactly how it's supposed to work when the body is strong. But that successful process relies entirely on one massive assumption, that a robust immune system is fully awake and doing its job to help the medicine actually work. And this brings us to a hard truth about what changes at the end of life. I want you to think of the immune system kind of like an army. In this scenario, antibiotics are the weapons, the guns, if you will. But the soldiers who actually pick up those weapons and fight the infection, those are the immune cells that the body naturally produces. When someone's body is declining, they are producing fewer and fewer of those vital soldiers, and the ones that are left just aren't responding the way they used to. We can keep supplying weapons, giving more antibiotics, stronger antibiotics, trying different variations, but if the declining body lacks the immune cell soldiers to use them, the battle simply won't be won. If you've been feeling frustrated that a treatment hasn't worked, please know that clinical research completely backs up your experience. Extensive studies on frail, elderly patients at the end of life show that antibiotic treatments for UTIs frequently fail to clear the infection. Furthermore, they rarely even improve those painful symptoms, and they offer little to no meaningful benefit when it comes to survival or quality of life. The infection doesn't linger because you didn't try hard enough or because you didn't care enough. It lingers because the body simply no longer has the capacity to fight back.
Now, what's really important to talk about right now is your heart in all of this. It is completely 100% natural to want to keep fighting. When someone we cherish is sick, our deepest human instinct is to do absolutely everything possible to fix it. That fierce desire to push for aggressive treatments comes directly from your deep love for them. It's a beautiful protective instinct. You want to save them, and that is so understandable. But we do have to gently look at the hidden costs of pushing harder when the body is just trying to rest. Stronger, more aggressive antibiotics come with very real, very heavy side effects. They can cause severe nausea, diarrhea, a total loss of appetite, uncomfortable yeast infections, and really painful changes in the gut bacteria. In a person who is already so fragile, these side effects don't just pass by lightly, they cause significant, tangible suffering. We might actually find ourselves in a heartbreaking situation where we're making our loved one feel physically worse in our desperate attempt to make them better.
So the crucial point we arrive at is recognizing a really profound difference. There is extending a good, comfortable quality of life, which is prolonging living. And then there is the alternative, drawing out the painful winding down process, which is simply prolonging dying. Those are two very distinctly different things, and as caregivers, our compass must always point toward comfort and dignity. If an infection just isn't responding, or if the side effects of the medicines are adding to your loved one's suffering, we have to pause. We have to take a breath, look at them with all the love we have, and ask honestly, are we fighting a battle we cannot win? I want to reassure you, from the bottom of my heart, that if the answer is yes, choosing to stop an ineffective treatment is not giving up. It is a profound act of wisdom. Avoiding those aggressive antibiotics is a brave, deeply loving choice.
When we make that brave choice, our focus shifts entirely to total comfort care. We step away from the battlefield, and we step into the sanctuary. This means our priority becomes managing their pain perfectly, reducing any anxiety or restlessness, easing shortness of breath, and doing everything in our power to keep them calm and at peace. These are things we absolutely can do well, and in these final days, they matter more than anything else.
As this natural decline continues, I want to gently walk you through some of the signs you might see, so you don't have to feel so afraid. You'll likely notice increased weakness and profound fatigue. You might see more confusion, disorientation, or even delirium. They may seem more distant or less responsive to your voice, and they will naturally begin sleeping much more. Watching this can feel overwhelming, I know, but please remember, this is the normal, expected pathway of the body preparing for rest.
You see, the infection they've contracted is not some unexpected tragedy that happened to them out of nowhere. It isn't something that could have been perfectly prevented if only someone had done something differently. Rather, the infection is intimately part of the body winding down, exactly as it was always going to do. Often, the infection is simply the mechanism that provides a gentle closing of the door.
And so your role shifts into something incredibly beautiful. You don't need to be a doctor or a nurse to provide the most profound comfort. You can offer peace simply by being present in the room, by holding their hand gently, by speaking softly to them, sharing memories, or just letting them hear the reassuring love in your voice, by keeping the lighting soft, playing their favorite calming music, and maintaining a peaceful environment. These simple, non-clinical acts preserve their dignity and blanket them in love. This pure presence is your absolute greatest gift to them. But please remember, you are never alone in this. If you notice uncomfortable symptoms changing or worsening, or if you simply have questions about what you're seeing, please reach out to your hospice team. They are there for the medical support, yes, but they're also there to hold your hand, to answer your questions honestly, and to help you navigate the heavy grief and confusion that naturally comes with this territory. Do not ever hesitate to call them at any hour.
As we conclude our time together today, I want to leave you with this guiding question. How can we best show love and ensure peace in these final days? More often than not, the answer is found not in more interventions or more medicines, but in the quiet grace of your presence and in giving them the permission to comfortably rest. Thank you so much for listening, for your open heart, and for the beautiful care you're providing to your loved one. Take good care of yourself and each other.